So here's another project breakdown. This is a medical production video. We were asked to come out to Wesley Long here in Greensboro, North Carolina, to go over to their department for radiology and speak to the doctors and have them talk about certain procedures that they do and what it was for the patient that they can expect. The patient knows ahead of time what they can expect for the procedure. This is kind of near and dear to my heart because as a relative of a survivor of cancer, 2 of them, I really saw the importance of this because the doctors say it day in, day out what these procedures are. And when you're getting told this news, you're shocked. You're in shock, right? So the goal was to allow the doctors to go over these procedures on video so that the patient can review later, see it then, review it in the middle of the night when they're wondering what the procedure is going to be like the next morning, whenever. They just had that extra bit of knowledge that kind of helps them know what's getting ready to happen and how this Wesley Long, this hospital is going to help them with their situation and their cancer and whatever it is that they're going to go through. So we have done a lot of work for them before. I'm going to break down this video for you real quick. It was a 1-camera shoot for 2 different days. One was the actual day of shooting the doctors. We had them come in. When it comes to medical staff, you have just a few minutes because they're on the ball. They have schedules of patients just rolling in, so you got to be quick and ready to run in, run out for them. So we went in, got set up, let them come in when they had time, and got the procedures recorded of what they tell patients, and then they took off. Next day was we set up a couple different actors and actresses to come in and have them go through the procedure and kind of act it out with the staff, and not necessarily with the doctors but with the staff, so they could then see faces, and when they know when they go in the next day there's probably going to be a familiar face that they're going to recognize, which is really great. So we have made an animation for them, made sure that brand is there.
Hi, my name is Dr. Sarah Squire, and you are about to watch a video which will educate you on the basics of radiation therapy.
So this was I believe it was a 4-point lighting. We have even lighting going across the face to kind of give it a nice even look. We had a small hair light coming from this direction, helping out with that cheekbone and kind of breaking her out. And we also threw a different colored gel and light on against the back wall so we can see all this blue happening just to kind of help her pop out in the picture. Let's scroll on through. This was actually a 1-camera, but it feels like a 2 because we shot it in 4K on the FS7 and the Shogun, Atomos Shogun recorder, so we could cut in, cut out, and just kind of give that different angle or a different look. Not necessarily a different angle, but a different depth of what they were seeing.
So we get a chance to
also having that bottom identifier I always talk about right down here.
sit with each other, answer any questions that might arise, and I'll also...
So let me go ahead and scroll forward on through. Here's the 2nd day shoot for our actress there. She was coming in. It's kind of funny. She said she has a really big phobia of cancer and whatnot, like a lot of us do. And she said she didn't realize she was going to be acting this out. And she thought, you know, this is good that I can actually see what the procedure is like. God forbid I ever have to go through this, or a family member, but she said it was just an eye-opener for her, which is basically the goal, to help someone understand the procedure. So the staff helps her in. We're actually on actually the 2nd camera would be the A7S. I forgot to mention that before. With the gimbal just kind of floating around. We have a couple of lights lit up in the room to kind of even it out a little bit. Same day, B-roll, literally grabbed the doctor when she says, I have 4 minutes, can we do these shots? Yeah, cool. Came running in, had the gimbal, had 1 light set up in the room, and we just had to be quick with it. Some custom lower thirds with the colors that corresponds with their brand. And scrolling on through, a little bit more B-roll, another angle, but yet still 1 camera, keeping the cost effective and down. And end out with a personal note.
Thank you so much on behalf of Cone Health Cancer Center for listening to this presentation. We know that it takes a tremendous amount of courage to go through this, and we can imagine that you may be feeling a lot of stress at this point in time.
So that was the goal. The goal was just basically actually a 2-camera shoot, 2 different days. Get in there, work with the staff, help the doctors, get these processes explained a little better for people that just got told this news, and help them with their journey of getting cured and getting taken care of. So that was a real good project. I enjoyed it. I enjoy helping the medical field. I enjoy shooting in the medical field because I think there's some good people in there, and I just kind of like to support them with doing what we can provide here at Safe House. Thanks.